I think I wanted to get into women's medicine pretty much the third year of medical school. I started working with a family physician who worked out in rural Virginia, and she did it all. She did deliveries, she took care of women for their GYN problems, she did prenatal care, and I would wake up at 2 a.m. and go to the hospital and do deliveries with her. And I think it was at that moment I realized I wanted to be just like her. What I enjoy most about women's medicine, I think, is the challenge that I get every day talking to my patients and interacting with them. What's most important to me personally is forming a strong relationship with my patients and really helping them through all phases of their lives, whether that's from teenager to womanhood, and then eventually helping them go through menopause and dealing with the challenges of menopause as well. I think the most challenging aspect of my job is keeping up to date on medical technology and up-to-date treatments that are currently available to my patients. I try to stay up to date by following closely with the American College of Obstetricians and Gynecologists, reading journals and up-to-date articles. I also try to stay up to date on current events because I believe that is so important these days in establishing a woman's status and her health status as well. I definitely believe in comprehensive health care and treating both body and the mind. I think that is very personal to me as well. I really believe in exercising and eating a balanced diet, and I think that by being a good role model for my patients will also be able to learn from me. I think my most memorable patient encounter would be a patient that I took care of my last year of residency. She was a patient who was unfortunately admitted to the hospital for 2 to 3 months prior to delivery, and unfortunately she had to stay inpatient the whole time due to a very rare pregnancy complication. She didn't have any family in the area, and her husband was traveling the whole time, so I was pretty much her only support person in the hospital. So we went to her ultrasounds together, we went to counseling sessions together, we would take walks around the hospital. Eventually I was able to participate in her cesarean delivery as well, and when she delivered her baby girl, and it was truly a memorable moment for me. I would describe myself as a patient, calm, and warm-hearted person. In my spare time, I really enjoy spending time with my husband and my baby boy. Right now, I think family is the most important to me. With the time outside of work, I really enjoy just spending any moment I have with them. I think what makes Orange Coast Women's Medical Group different from other OBGYNs in the area is the large amount of expertise and diversity we have within the practice. I think we really try to work in a collaborative fashion together to try to provide the best medical care for our patients.